Which chamber of the heart pumps oxygenated blood to the body? Answer is left ventricle. The normal resting heart rate in adults is 60 to 100 BPM. The largest artery in the body is aorta. The pacemaker of the heart is set and node. Which valve is located between the left atrium and left ventricle? Mitral valve. Blood enters the right atrium through superior and inferior vena cava. Which blood vessel carries oxygenated blood from the lungs to the heart? Pulmonary vein. The lub sound of the heart is produced by closure of mitral and tricuspid valves. The outermost layer of the heart is pericardium, epicardium. Which electrolyte is most important for cardiac muscle contraction? Calcium. The blood supply of the heart muscle is provided by coronary arteries. Which valve prevents backflow from the right ventricle to the right atrium? Tricuspid valve. The normal cardiac output of an adult is approximately 5 L-min. The apex of the heart is formed mainly by the left ventricle. Which chamber receives oxygenated blood from the lungs? Left atrium. The pulmonary artery carries deoxygenated blood. ECG stands for electrocardiography. The thickest wall is found in the left ventricle. Which part of blood transports oxygen? RBCs. The AV node is located in right atrium. Hypertension means high blood pressure. The normal blood pressure of an adult is approximately 120/80 mmHg. Which artery supplies the brain? Carotid artery. The QRS complex in ECG represents ventricular depolarization. Myocardial infarction is commonly known as heart attack. Which blood vessel carries deoxygenated blood from the heart to the lungs? Pulmonary artery. The heart is located in the mediastinum. The average adult heart weighs about 300 g. 29. The P wave in ECG represents atrial depolarization. Which valve lies between the right ventricle and pulmonary artery? Pulmonary valve. The functional unit of the cardiovascular system is blood vessel. The P wave in ECG represents atrial depolarization. Which blood vessel supplies oxygen directly to the myocardium? Coronary artery. The average adult heart weighs about 300 g. Bradycardia refers to a heart rate below 60 bpm. Tachycardia refers to a heart rate above 100 bpm. Which chamber has the thinnest wall? Right atrium. The septum separates right and left sides of the heart. The cardiac cycle consists of systole and diastole. The term systole means contraction of heart muscle. The term diastole means relaxation of the heart. Which blood component helps in clotting? Platelets. The oxygen-carrying pigment in RBCs is hemoglobin. Which artery carries deoxygenated blood? Pulmonary artery. The electrical impulse travels from SA node to AV node. The dub sound of the heart is caused by closure of aortic and pulmonary valves. Which condition is characterized by chest pain due to reduced blood supply to the heart? Angina pectoris. The instrument used to record ECG is electrocardiograph. Which blood vessel returns deoxygenated blood from the body to the heart? Vena cava. The normal pulse rate in a healthy adult is 60 to 100 BPM. Thanks for watching. Subscribe for more videos.